Medical Nanotechnology, Exploring Innovation in Antifungal Therapy. Welcome students. Today, we will embark on a journey exploring the fascinating world of medical nanotechnology and its immense potential in combating fungal infections. In this comprehensive lecture, we will delve into various aspects of engineered nanomaterials and their applications, advanced drug delivery systems, lipid-based nanoparticles, photodynamic therapy, precision medicine, battling biofilms, inhalation therapy, optimizing therapeutic outcomes, innovative approaches, and how nanotechnology can unleash the immune system to effectively fight fungal infections. So, let's begin our exploration of this exciting field. Engineered nanomaterials have revolutionized medical research, particularly in the field of antifungal therapy. These nanomaterials possess unique properties due to their nanoscale dimensions, allowing for precise targeting, enhanced drug delivery, and increased therapeutic effectiveness. Moreover, their surface characteristics can be modified to effectively combat fungal infections. For instance, functionalizing nanoparticles with antifungal agents can significantly improve their efficiency in eradicating fungal pathogens. Additionally, the incorporation of nanoparticles in dressings, ointments, and coatings can prevent fungal colonization and promote wound healing. The field of nanomedicine has witnessed remarkable advancements in drug delivery systems targeted towards fungal infections. Nanocarrier systems, such as liposomes, polymeric nanoparticles, and dendrimers, offer numerous advantages including increased drug stability, controlled release, and improved bioavailability. These nanocarriers can effectively deliver antifungal agents to the site of infection, ensuring optimal therapeutic outcomes while minimizing adverse effects. Through precise control over drug release kinetics, nanocarrier systems also combat drug resistance, a major challenge in antifungal therapy. Lipid-based nanoparticles, such as solid lipid nanoparticles, SLNs, and nanostructured lipid carriers, NLCs, have gained significant attention in antifungal therapy. These nanoscale lipid systems offer remarkable biocompatibility, stability, and easy scalability. Their unique lipid-based architectures allow for efficient entrapment of antifungal agents, facilitating their targeted delivery and sustained release. Furthermore, surface modifications with ligands or antibodies enable enhanced fungal recognition and binding, further augmenting their therapeutic potential. Apart from drug delivery, nanotechnology has revolutionized the field of antifungal therapy by offering innovative solutions beyond traditional drug-based approaches. For instance, nanosensors can be utilized to detect fungal infections at an early stage, facilitating timely intervention. Nanoscale antimicrobial coatings can be applied to medical devices and surfaces to prevent fungal colonization and biofilm formation. Moreover, nanotechnology enables the development of vaccines, immunomodulators, and gene therapy approaches for enhanced fungal infection management. Photodynamic therapy, PDT, is a groundbreaking technique that utilizes light-sensitive agents, called photosensitizers, to generate reactive oxygen species upon light activation. Nanoparticle-based PDT has emerged as a promising strategy to combat fungal infections. Photosensitizer-loaded nanoparticles can selectively accumulate in fungal cells, ensuring targeted therapy. The controlled release of photosensitizers at the site of infection, in conjunction with precise light exposure, leads to efficient fungal cell eradication without harming healthy tissues. Precision medicine, an approach tailored to individual patients' characteristics, is gaining traction in the realm of fungal infections. The utilization of nanotechnology facilitates personalized drug delivery, taking into account factors such as infection location, patient-specific characteristics, and drug resistance patterns. Nanoparticles can be engineered to actively target the infected site, enabling the delivery of optimal drug doses for improved treatment outcomes. This patient-centric approach significantly enhances therapeutic efficacy and reduces the likelihood of treatment failure. Nanoparticles not only act as carriers for antifungal agents but can also exhibit intrinsic antifungal properties. Several nanoscale materials possess inherent antifungal properties due to their physicochemical characteristics. Metal nanoparticles, such as silver and copper, exhibit potent antifungal activity by inducing membrane damage and oxidative stress in fungal cells. Additionally, nanomaterial-based strategies can inhibit fungal virulence factors, disrupt biofilms, and modulate fungal immune responses, presenting new avenues for effective fungal infection management. Biofilms, complex communities of microorganisms embedded in a protective matrix, represent a formidable challenge in antifungal therapy. However, nanotechnology offers novel strategies to combat biofilm-associated fungal infections. Nanomaterials can disrupt the biofilm matrix, enabling the subsequent penetration and eradication of fungal cells. Additionally, nanoparticles can be functionalized with anti-biofilm agents, such as quorum sensing inhibitors or enzymes, to effectively prevent biofilm formation and eradicate existing biofilms. This approach holds great promise in overcoming biofilm-associated drug resistance. Inhalation therapy has gained significance in the treatment of pulmonary fungal infections. Nanotechnology plays a vital role in developing optimal inhalable formulations, enabling efficient drug delivery to the deep lung tissues. Nanoparticles can be engineered to overcome biological barriers, ensuring better drug deposition and prolonged drug release in the lungs. Furthermore, surface modifications of nanoparticles enhance their mucoadhesive properties, facilitating targeted drug delivery to the infected respiratory tissues. Inhalable nanomedicines represent a promising avenue for effective treatment of pulmonary fungal infections. Nanotechnology offers tremendous potential in optimizing therapeutic outcomes for fungal infections. Through precise control over drug release kinetics, nanocarriers can prevent suboptimal drug concentrations, reduce dosing frequency, and minimize adverse effects. Furthermore, nanotechnology allows for combination therapies, where multiple antifungal agents can be co-delivered using nanostructures, enhancing synergistic effects and mitigating drug resistance. Moreover, nanoscale drug delivery systems can be tailored to exploit specific fungal vulnerabilities, maximizing therapeutic efficacy. Innovation is rife within the field of medical nanotechnology for fungal infections. Researchers are continually exploring novel approaches to enhance antifungal therapy. Examples include the development of self-assembled nanovesicles, nanorobots, and engineered nanoparticles with multifunctional capabilities. These innovative platforms allow for precise drug delivery, synergistic effects, and real-time monitoring of treatment efficacy. Furthermore, the integration of nanotechnology with other emerging fields, such as artificial intelligence and biosensing, holds immense promise in augmenting fungal infection management in the future. The immune system plays a crucial role in defending the body against fungal infections. Nanotechnology enables a range of innovative strategies to augment immune responses against fungal pathogens. Nanoparticles can be used to deliver immunomodulatory agents, such as toll-like receptor agonists and cytokines, directly to immune cells, stimulating their activation and promoting antifungal activity. Furthermore, nanoscale vaccines can trigger targeted immune responses against specific fungal antigens, enhancing the immune system's ability to combat infections. Such approaches hold considerable potential in revolutionizing antifungal immunotherapy. In conclusion, medical nanotechnology has transformed the landscape of antifungal therapy, providing innovative solutions to combat fungal infections. Engineered nanomaterials, advanced drug delivery systems, lipid-based nanoparticles, photodynamic therapy, precision medicine, and various other nanotechnology-based approaches are revolutionizing the management of fungal infections. This multidisciplinary field continues to push boundaries, offering new avenues for therapeutic optimization and personalized medicine in the battle against fungal pathogens. I hope this comprehensive lecture has provided valuable insights into the design, applications, and potential of medical nanotechnology in antifungal therapy. As future healthcare professionals, it is crucial to stay updated with the latest advancements in this field to effectively combat fungal infections and improve patient outcomes. Thank you for your attention, and an exciting journey awaits you in the world of medical nanotechnology.